there, and welcome to my channel, My Nursing Compass. I am your navigator. I love to build bite-sized knowledge quests that I use during my tutoring sessions to help you think like a nurse. Again, this is a supplemental educational nursing material for you to help with your class studies. It does not replace your classroom or your instructors or your nursing programs. My job here is simple. I want to help you connect the dots and start thinking like a nurse, and ultimately not kill our patient along the way. So this is the Renin Angiotensin Aldosterone System Knowledge Quest Assessment. Okay, this is part one. There are three parts to this, and it correlates with the RAAS overview slide deck that I've created before this. So we will cover the first 15 out of 30 questions available in this part one. And if you want the complete deck for your own studying, including rationales for incorrect answers and linked video breakdowns, you can access that through My Nursing Compass. The link will be below for you. All right, so let's get this started on this knowledge quiz. So this knowledge quest, you will test your understanding over the overall structures of the RAAS system, what leads up to Renin release, the order of the cascade, what each step accomplishes. This is about understanding how the pieces connect. I set up my assessments and my mini quizzes and my learning deck slides on a journey. I want to be able to walk you through this step by step. You have the information now. Let's connect it and see how it all works together. Okay. All right, so this is an interactive Google slide. So this has a link for the video and how to do this all on your own. So for now, we're going to skip that. All right, first question. So remember, read the question. Ask yourself, what information do I know about this? And what information am I missing? If at any point you do not know something, you need to pause and you need to go on a knowledge quest. Okay, those are the crew that know me know this very well. You cannot answer something or be safe at the bedside if you don't know. Go use your resources and go look it up. Okay, so what best describes the Renin Angiotensin Aldosterone System, also known as RAAS? A hormone pathway used mainly to control urine output, a stress response that increases heart rate and cardiac output, a coordinated body system that helps regulate blood pressure, blood volume, and blood flow, a kidney-only response that turns on when sodium levels are abnormal. So I'm going to give you about 15 seconds here to think about this and let you select your best response. What best describes the RAAS system? All right. If you chose C, or a coordinated body system that helps regulate blood pressure, blood volume, and blood flow, you are correct. Woohoo! So the RAAS is a multi-organ hormonal pathway designed to maintain circular stability. It responds to change in pressure, volume, and perfusion by adjusting vascular tone and renal sodium handling. Its purpose is to systematic circulation support to help the body maintain homeostasis. Which situation could cause the body to activate RAAS? Loss of blood or fluid, low sodium delivery to the kidneys, low blood pressure or poor perfusion, all of the above. Which situation would cause the body to activate RAAS? If you selected all of the above, you are correct. RAAS activates when the kidney sense reduced effective circulation, loss of volume, decreased sodium delivery, or reduced perfusion pressure can all signal inadequate blood flow to the kidneys. These triggers represent different expressions of the same underlying circulatory problem. There is also a special circumstance that could activate RAAS as well, and we will get into that later. For now, just focus on the main triggers for RAAS. Blood pressure is best described as what? The amount of oxygen in the blood, the push that moves blood forward through the vessels, the amount of blood inside the heart, the number of red blood cells. What does blood pressure mean to you? If you said the push that moves blood forward through the vessels, you are correct. Blood pressure represents the force exerted by circulating blood against vessel walls. This force is necessary to drive blood through organs, including the kidneys. When pressure falls, filtration decreases, and RAAS may activate to restore perfusion. Blood volume refers to blank. How much fluid is inside the blood vessels and available to circulate? How much oxygen is bound to hemoglobin? How much fluid is in the tissues? The speed of blood flow through capillaries. Blood volume. If you answered how much fluid is inside the blood vessels, you are correct. Blood volume refers specifically to intravascular fluid available to maintain perfusion. Adequate circulating volume supports pressure and filtration at the glomerulus. When intravascular volume falls, renal perfusion decreases and RAAS can be triggered. Remember those wonderful patho modules, intravascular, interstitial. Third spacing, all of that plays a role here, so know your vocab. Perfusion means blood is present somewhere in the body, blood is moving through tissues, the kidneys are producing urine, sodium is being excreted. Give you about 15 seconds to think through this. Perfusion. What does perfusion mean? The definition of perfusion. If you said blood moving through tissues, you are correct. Perfusion requires active blood flow through capillary beds to deliver oxygen and nutrition. It is not simply the presence of blood within the body. Decreased perfusion to the kidney signals potential circulatory compromise. If you had chose C, urine output is an indicator. It is something we see at bedside that we can measure when perfusion is doing beautifully. When blood vessels dilate too much, what happens to resistance and pressure? Resistance is unchanged. Resistance increases and pressure rises. Resistance decreases and pressure rises. Resistance decreases and pressure falls. So think about your blood vessels. When they dilate too much, what happens? If you picked resistance falls and so does pressure, you are correct. So vasodilation increases vessel diameter, which lowers synthetic vascular resistance. So think of this as a garden hose. If I was to hold that garden hose in my hand and turn on that hose with that water behind it, and that would indicate your pump, your heart turning on. If your heart is turning on, it is pumping that blood through the body, and there's a kink somewhere, it's going to back up pressure, okay? And we're going to see that by elevated blood pressure, okay? When we vasodilate instead of vasoconstrict, which is what would cause that backup, if we opened up those vessels, then our pressure will decrease, okay? The kidneys are the starting point of RAAS because they monitor blood flow and sodium delivery, oxygen saturation and hemoglobin, heart rhythm and stroke volume, glucose and insulin levels. Kidneys are the starting point of RAAS because they monitor what? What are our kidneys doing? So blood flow and sodium delivery. Ding, ding, ding. Kidneys monitor both mechanical stretch in the atrials and sodium concentrate reaching the macula densia. These signals reflect upstream filtration and perfusion status. When either signal falls, Renin release may occur. Match the hormone to its home base, where it comes from. So which pairing is correct? Renin equals the liver. Angiotensin works in the kidneys. Aldosterone for the adrenal glands. Or angiotensin 2 in the pituitary. Which one is matched up appropriately? If you said aldosterone from the adrenal gland, you are correct. Aldosterone is produced in the adrenal cortex and acts on the distal nephrons to increase sodium reabsorption. This promotes water retention and supports circulating volume. It is the final hormone step in the RAAS cascade. Angiotensin 2 is formed primarily in the what? Kidneys, liver, lungs, adrenal gland. Where is angiotensin 2 formed? If you said the lungs, you are correct. Angiotensin converting enzyme located primarily in the pulmonary epithelial tissues, endothelial tissues, converts angiotensin 1 into angiotensin 2. It is the primary active mediator of vasoconstriction, aldosterone release. This conversion step is central to RAAS activation. Question number 10. 5 more to go. Y'all are doing amazing. Fluid balance is mainly influenced by RAAS through what? Insulin telling cells to take up glucose. Aldosterone telling kidneys to retain sodium. Histamine increases capillary permeability. Thyroid hormone increasing metabolism. Fluid balance is mainly influenced by RAAS through what? If you said aldosterone telling kidneys to retain sodium, you are correct. Aldosterone increases sodium reabsorptions in the distal nephrons, and water follows sodium osmolectically. This expands intravascular volume and helps restore blood pressure. It represents a key volume-preserving mechanism of RAAS. The kidney's job in homeostasis is best described as producing bile for digestion, filtering the blood and deciding what stays in circulation versus leaves in urine, creating antibodies to fight infections, making insulin to control blood sugar. Kidney's job in homeostasis is best described as what? What does the kidneys do? If you say filter the blood and decide what stays, you are correct. The kidneys filter plasma at the glomerulus while selectively reabsorbing needed substance. This filtration process depends on adequate hydrostatic pressure. Through this mechanism, the kidney evaluates circulatory sufficiency. The kidneys watch 3 connected signals to evaluate circulation. Which list matches the deck? Glucose, insulin, body temperature. Blood arriving plus pressure push, sodium delivery through the nephrons. White blood cell count, fever, inflammation. Oxygen saturation, potassium levels, and heart rhythm. Which ones are connected? If you chose blood arriving and pressure push, sodium delivery, you are correct. Renal evaluation begins with blood flow and pressure entering the glomerulus. Adequate pressure drives filtration, which determines glomerular filtration rate, GFR. Hold on a second. Is that related to our labs? You would be correct, and we will get into that on another slide deck. GFR influences how much sodium reaches the distal nephrons, forming a linked sensing chain. Blood enters the kidneys through Bowman's capsule, efferent arterioles, afferent arterioles, collecting ducts. Where does blood enter the kidneys through? If you went with afferent arterioles, you are correct. They deliver blood into the glomerular capillary bed for filtration. Changes in pressure within this vessel directly influences hydrostatic force and the GFR. It is also where the glomerular cells detect stretch. The glomerulus is best described as the muscle that pumps blood, a hormone gland that releases Renin, the tube that stores urine, a small ball of capillaries that act as the kidney's infiltration unit. The glomerulus is best described as what? If you chose a small bed of capillaries, you are correct. The glomerulus consists of specialized capillaries designed for high-pressure filtration. Hydrostatic pressure forces plasma across the filtration membrane into the Bowman's capsule. This step initiates the urine formation. Last question. Hydrostatic pressure means what? Electric conduction through the heart, fluid pulling inward by osmosis, fluid pushing against a surface, oxygen binding to hemoglobin. Hydrostatic pressure means what? If you said fluid pushing against the surface, you are correct. Hydrostatic pressure refers to the outward force exerted by fluid within a confined space. In the kidneys, atrial blood pressure creates this force within the glomerular capillaries. That is how we drive filtration in the Bowman's capsule. Good job, good job, good job, everybody. So brain break. That completes part 1 of the RAAS Knowledge Quest assessment. If some questions felt easy, that is awesome. That means your foundation is holding from patho and you're carrying that over into your fundamentals. If some of it didn't, that is your cue to review and strengthen those areas. You need to go on a knowledge quest, okay? If you're looking for the fully interactive knowledge quest, head over to my nursing compass using the link in the description below. There you'll find the complete 150-slide interactive learning deck, including rationales for incorrect answers. You'll also find the full RAAS breakdown learning side over there, as well as dosage calculation practices and more in this fun interactive self-paced knowledge questing. Stay tuned for part 2.